Hey everyone, this is Ana from Dr. Midnight, and this is another video where I will talk about prednisone and immunosuppressants. And before I start this video, I would like to say that, unfortunately, last week I had to get exposed to sunlight. And sunlight is not the best friend of a person who has VKH. So next video I will talk everything about that. Ana, is this really necessary to make an entire video only on prednisone and immunosuppressants? Yeah, VKH kinda has its own universe. However, the side effects of the medications we use deserves its own chapter. Our good old friend prednisone, or drop-dead pred as I like to call it, is a medication that is being used since the 1950s, and it can be used to treat various diseases, ranging from simple allergies to our autoimmune diseases. Prednisone belongs to the family of the glucocorticosteroids, a group of hormones that are made by the adrenal glands. And those hormones play a major role in our body because, for example, they can control our metabolism. Once we take prednisone, our liver will convert it to prednisolone, a very important anti-inflammatory. Once we know all of this, it then becomes much easier to understand why this particular drug has so many side effects. Since we use the drop-dead pred for so long and in very high doses, it can lead us to very undesirable side effects such as a lot of weight gain, water retention, and a glorious moon face. Pimples, alterations in the sugar levels in the blood, watch out, diabetics, hormonal alterations as well. Women, please be careful with your periods, sudden mood swings, anxiety, even psychosis in some cases. And, believe it or not, even cataracts in case of prednisolone eye drops. But Ana, if I'm using this stuff to make my vision better, why on earth did my ophthalmologist prescribe me this? That's because the anti-inflammatory effect of prednisone is quite strong. And even though your vision may be getting wider and wider with the progress of cataract, you have to understand this. Inflammation itself can lead to permanent vision loss. Cataracts, however, can be corrected by surgery. And do I have to take prednisone forever? Not really, for that we have immunosuppressants. Each immunosuppressant has its own different mechanism and therefore different side effects as well. However, they all have a few things in common. Number one, just like prednisone, immunosuppressants are metabolized by the liver. So it's very important for you to take care with the ingestion of fat and alcohol. That's if you don't wanna, get vomiting and God knows what else. Number two, they will make you more vulnerable to viruses, bacteria, and fungus. So why did my rheumatologist prescribe me this again? That's because we have a disease where our organism becomes very confused. It begins to think that our own cells are enemies. And that leads our immune system to be on red alert all the time. Imagine this fire that's very hard to control. Immunosuppressants are nothing more than the firefighters. A subscriber has asked me if she would take immunosuppressants forevermore. Just like Beekman used to say, the mileage may vary. There are people out there who get the remission in under a few months or a few years. Others, like myself, may treat VKH for several years. I will complete 10 years of treatment in 2022. My doctors think that I have a classic case of VKH. That means a syndrome that is very unpredictable and inflammates a lot. And just a quick reminder for you guys, there's a difference between remission and an actual cure. A cure means that, for example, let's suppose you get a cold or flu or something. You do some treatment for that flu or for the cold, whatever, and then you get rid of it. Remission, however, doesn't work like this. Imagine for a minute that we have in our body this switch that either turns our syndrome on or off whenever it wants. When our syndrome begins to manifest its first symptoms, that's when our body turns that switch on. Remission happens when our body simply decides to turn that switch off. Okay guys, that will do for today. And remember to leave that like and to comment here. That helps YouTube to suggest this video for those who really need it. In the next video, I will talk about skin and hair related to our particular alien syndrome. Bye!